Okay, so we've already assessed your apical pulse rate and rhythm, and that was normal. So now we're going to move on to your other lung sounds. So I'm going to assess for any brevets for your aortic, your pulmonic, your tricuspid, and your mitral valvular areas of your heart. So now I'm going to assess your brevet. Okay. Okay, so there were no brevets present. Next, I'm going to go ahead and move to your abdomen. So if you don't care to just lay down for me. Okay. And do you care to just raise your shirt just a little bit? There you go. Okay, so I'm going to assess your umbilicus and look for any pulsations. So if you could just breathe slightly for me. And there's none present, which is normal. The next thing I'm going to do is assess your bowel sounds in all 4 of your quadrants. And I'm going to start by listening to these. Okay, and I heard some gargling and cascading sounds, but those are normal. And you didn't have any involuntary guarding, which is normal. The next thing I'm going to do is percuss over all 4 quadrants. So let me know if you have any pain or tenderness, okay? Okay, that is normal. And we heard dullness over the spleen and the liver, which is also normal. The next thing we're going to do is palpate your bladder. So, do you have to pee?
No.
Okay, so I'm just going to palpate over your bladder, okay? And at this point, if she did, I would have her, of course, go ahead and go to the bathroom prior. Is there any tenderness? Okay, very good. The next thing that I'm going to do is perform light and deep palpation. So if you could just relax for me. I'll start with light. And I don't feel any masses. And then I'm going to start with deep. And there's no involuntary guarding. Very good. And as you can see, her skin has no abrasions. It's nice and warm. It has even coloration. There's no discoloration, bruising, or abrasions or anything like that. And her skin turgor is nice and normal. So she looks nice and hydrated. The next thing that I'm going to do is assess your inguinal area. So I'm just going to verbalize this, but I would assess her area and make sure that she doesn't have any abrasions, lesions, or anything like discharge that would be abnormal. And I would also take her femoral pulse, which would just be right in this area. And you want to make sure you note the strength of that too. So for this video, we'll say it's 84 beats per minute and that it's symmetric evenly and bilaterally. The next thing that I'm going to do is I would also palpate the lymph nodes. So for males, sometimes it can be normal to have a reading that is about a little bit about a centimeter, but not an inch, because that's just normal for them. But I would also palpate her lymph nodes as well, make sure there's no swelling or tenderness. Then I would move to the lower extremities. So if you want to go ahead and sit up for me, you can do that. Very good. So first we're just going to look at her legs, and her legs are nice and symmetric. They don't look like one's longer than the other. They look very even. We would also, again, throughout the whole video, we would assess the contour and color of the skin, the moisture, the temperature, and all of the other characteristics of the skin. But for right now, she has her pants on, but a normal patient would not. But so we'll say her skin is good for right now. But for the lower extremities, we are going to test the following pulses, and it's popliteal, tibial, dorsalis, pedis, and then we'll move on to her range of motion. So I'm going to start with your tibial. And so I'm going to assess your pulse, which we would say is even and normal bilaterally. And then we would move to her dorsalis pedis, which is going to be between, I'm going to take your sock off for just a minute. Sorry. So then we would assess this pulse, and it's between her big toe and her second big toe. Okay, and we would compare that bilaterally. I'm going to put your sock back on. Sorry. Okay, so we compare this bilaterally. The next one that I'm going to do is the popliteal. So I'm going to have you lay down for just a minute. Very good. And I'm going to have you just take your knees to your chest, just one of them. Very well. And then I will have her just hold this and assess for her popliteal. Okay, and we'll say that's even. And you would, of course, assess it bilaterally and make sure it's smooth and even. And that will say it's 84 as well, beats per minute, and with a +2. And you can go ahead and sit on the side of the bed again. So I'm going to test her strength of her range of motion. So I'm going to go ahead and just have you go ahead and kick your legs toward me. Push, push, push. Good. Pull back. Very good. And then we're going to do the same thing with your feet. So just sit straight out. Okay, point your toes down. Good. Pull them up. Good. And then I'm also going to test her hip range of motion. So I'm going to have you stand up for me. Very good. And can you just take your leg away from you? Good. And take it back. Sorry, be careful. All right, do the other side for me. Very good. So that is normal as well. And then go ahead and we'll test her. We'll do circumduction. So can you just go like this for me? Very good. And the other leg. Very good. Okay, you can go ahead and have a seat. So she has strong, active range of motion without any limitations when it comes to resistance. The next thing we're going to do is move on to your neurological